So let's say, for example, the chief complaint for this particular patient is neck pain on the left. So we, of course, are concerned and want to address this neck pain, but we want to find out if it's actually the thing that needs to be fixed and handled. So what I'm going to do is apply some pressure along the neck on the left here, trying to elicit on purpose a weakness so I can find where this patient's actual pain is stemming from. Now, I can have my hand on several different locations. It can be just a general pain pattern that when I apply pressure causes this weak response. I might also be hitting specific acupuncture points and or meridians from an acupuncture standpoint. And I also could be on specific vertebral levels from a chiropractic standpoint. The next thing we must determine, though, is what else might be going on in the case. So the next step of the procedure is to do what we call a body scan. So what we do is we start at the top of the patient's body, okay, coming down, and let's say we get weakness here. This would also be an area of stress. So my hand was on the thyroid gland. So this is the body's way of indicating that there might be some stress or upset on the thyroid gland in addition to whatever's going on in the neck region. So I'm going to continue on with my body scan to see if I don't find any additional areas. And say I continue on and I come over here and I get weakness here. My hand here is on the liver. So now I have some general pain situation on the left on the neck. I have a weak thyroid and I have a weak liver. So I'm going to continue on the rest of the body scan and continuing to check all the organs and areas as I go along. And let's say I get weakness here and I get weakness here. That hand contact was on the adrenal gland. So now in completing my analysis at this step of the procedure, I now know I have not only a neck situation on the left, I also have some kind of compromise on my thyroid, my liver, and my adrenal glands. The next step of the technique, step 5, is to prioritize out which one is the one to handle. So how we determine this is we put the patient in what we call priority mode. It's a hand mode. And then we're going to go back and reassess these 4 locations that we had. And then you go and you put some pressure on that neck now in the priority mode, and the arm now locks or stays strong. This is the body's way of telling you, though this is an area of upset, it's not the priority. So now I need to go to the other 3 locations that I had, determine if one of those might be the actual underlying cause and priority to what's holding that neck problem in place. So what I do is I'm going to put my hand here again on the thyroid, and let's say that locks as well. So again, not thyroid. So the thyroid is not the situation we need to take care of first and foremost. Let's say we go over here to the liver and I do get weakness. So this is the body's way of indicating that the most likely priority we have is the liver. But we didn't check the adrenal glands yet, so let's go do that to confirm. And the adrenal on the right locks, and the adrenal on the left locks. So again, this is the body's way of indicating to us via the muscle test that the liver is the priority that we need to handle first and foremost. There are many different reasons why we experience ill health. So we need to find out if any of these toxins or poisons are interfering with this liver function. So the first thing we're going to do is grab test kits. And what we have in these test kits are the homeopathic frequencies of different items. So on this side of my test kit are foods. So I put that on the body, and then I'm going to reconfirm the liver situation and find out and determine if foods are an interfering factor of what this liver is having to deal with. So if I put this on and I get a weakness, no lock, that's the body indicating that there isn't any situation regarding foods. I will then flip the test kit over, and I will confirm or determine if there's immune challenges in the way. And again, if I were to experience a weakness or no lock, that's the body's way of indicating that we do not have immune stressors in the way. I then continue on with this procedure, and we have a chemical side, so we'll confirm if there's any chemical poisoning in the way, which there's not. We also do the most common heavy metals that patients and people are exposed to, and we get no lock again, so that again is telling us that there's not a heavy metal situation in the way. And the last thing we do is we determine neurological interference that scars can produce, and then I check that and no. So in this particular level situation, there are no barriers or stressors in the way. If there were, I would handle those right here and now, but for demonstration purposes, we're going to say that there aren't any interfering factors, which allows us to go on to the next step of the technique. The next step of the technique is then determining the specific nutritional support that this liver needs in order to heal. Now, the mistake we've noticed, and I personally experienced as a practitioner prior to doing this work, is putting the patient on any liver support based on my clinical training or guessing sometimes. So that's what gets us into trouble. So let's say, for example, I know a great herbal therapy for the liver. So, of course, you can take a sample bottle of that herbal therapy and put that on the body. And in order to determine if this is the correct nutrition for this liver situation, when I go back and recheck this muscle, match my pressure, the arm goes weak. Now, this is the body's way of indicating that this is actually the wrong therapy for this liver, because what we're looking for here is a lock. So if we put a different herbal therapy on, and then I say match my pressure, and now I get a lock, this is the body's way of indicating that it prefers this herbal therapy over this herbal therapy. This allows us to be ultra-specific within this work, and instead of, again, having to rely on textbook protocols or magic recipes, clinical training, and or clinical hunches, we can literally communicate with the body via the muscle testing in determining which is the correct therapeutic nutritional support for this liver and this patient's liver alone. And when we do this, we get a lock. So now we know we have the correct therapeutic intervention for this particular liver situation. The next step of the technique, now I want to go back and reconfirm what this does for the other active areas. The ideal situation is that handling this liver situation will also provide energetic and therapeutic support to the thyroid, the adrenal glands, and of course this neck pain, why we're doing this whole analysis in the first place. So now we're certain we have a lock on our liver with our therapy for the liver support specifically. Then I can go back and recheck the thyroid and confirm. If I were to get a lock here, that's the body's way of indicating to us that the thyroid is actually very happy about the fact that we're going to be getting some liver intervention here. Because most likely what's occurring, a lot of the symptomatic and problems that you're experiencing from the thyroid is a reaction to and or a result from a dysfunctioning liver. So this would be the body's way of indicating that handle the liver, and you're also going to, in essence, handle the thyroid. We also go then and we can confirm that on the two adrenal glands on the left and the right that we found. And if they lock as well, then we also know that the stress that was being placed on these adrenal glands was stemming from a deeper underlying layer, an underlying cause, primarily coming from what we've determined here today being the liver. So the question then would be, is what does this do for the neck pain? So I go back now and I put some pressure in the exact same spot that I had it before, and I tell the patient to match my pressure, and if it locks, that's the body indicating that this nutritional support for the liver has an underlying layer to its chronic long-term situation of neck soreness and pain and subluxation that is stemming from an unresolved and undetected liver situation. So if I got a lock there, that is the communication that the autonomic nervous system is giving me via a locked indicator muscle. So now that we have done the complete analysis, there's one last step in order to determine the final approach we're going to be using, and that is to get the exact right dose that the patient needs to be on. We do not rely on what our training said, we do not rely on our hunches, and we don't even rely on what the side of the label says. What we want to determine is what is the exact correct dose for this autonomic nervous system and this particular liver situation that this patient and only this patient is dealing with. So how we're going to do that is we're going to take the bottle, flip your hand over here, and we're going to dose this out one product at a time, one supplement at a time. So I put one in the hand, and I say match my pressure, and a lock is a way of the autonomic body to determining and telling me that one is totally acceptable. I then want to see if it can handle two. So I put two in the hand, I say match my pressure, and if I get another lock, that's the body's indications that it will be able to tolerate and utilize two. Let's say I put three in the hand and I actually go back and get this no lock phenomena. That's the body's way of indicating to me via the muscle test that 3 is actually overload. It's actually going to not get me the therapeutic results that I expect at the correct gradient for this individual's body. So I take the third one back out of the hand and reconfirm that I had it right at 2, and I get my lock here. And that's the autonomic nervous system's indication that 2 is the perfect dose for me. Now in building the program, if I happen to have other nutritional support on the body, and let's say I had 2 here, I would then go and do the same procedure for each of the individual bottles to dose it out. And this would allow me to build the most perfect tailor-made program for this autonomic nervous system's neck, thyroid, liver, and adrenals with the exact correct nutrition at the exact right doses.